Thank you for the invitation to present on this technique that we described some years ago. Is the superior capsule reconstruction with hamstrings. It's not okay. It's not working. Yes, this is my disclosure of conflict of interest. This is it's always the same slide. Okay. So different options have been described also today regarding the treatment of massive irreparable rotator cuff tears. And SCR is one of the different options. According to this algorithm proposed by Philippe Valentis, mostly indicated for isolated irreparable posterior superior rotator cuff tears, specifically for superior supraspinatus isolated tear. And as Tero described perfectly before, these are the indications. So also pseudoparalysis is considered an indication for SCR. Different technical modifications have been proposed, but the rationale of the technique remains unmodified over time. So the rationale is to reduce the humeral head into the glenoid socket and to improve a lever arm provided by the deltoid muscle. Graft options, as we know, fascia lata first for sure, extracellular dermal matrix, biceps. We have seen the use of biceps many times today. And the semitendinosus tendon autograft or allograft are different options recently considered. And I want to show you our rationale because we moved from long adult biceps to the semitendinosus. So according to this recent review of the literature, dermal allograft, fascia lata, and long head of the biceps tendon are all suitable options in terms of clinical outcomes. Cable reconstruction, because this is exactly the definition of using the biceps, the cable reconstruction has some advantages in comparison with the fascia lata because the donor side morbidity is quite limited. It does not increase operative time and cost. It's easy to manage during your procedure, so you can shift to this procedure if necessary during surgery. And a biomechanical study showed an adequate mechanical strength in comparison with the fascia lata. So there are 3 or 4 at least biomechanical cadaver studies that confirm that. So biceps is also an option as augmentation in rotator cuff, as demonstrated in some technical notes, but also in clinical reports. And this is one of the clinical reports that we presented a couple of years ago. That we defined the cuff plus, so finally it's just an augmentation of repairable massive tear. So the tear is completely anatomically repaired, but the biceps is used to augment, to increase the chance for healing. And these are our preliminary results, 15 patients at a more than 2 year follow-up, and we found a significant improvement in terms of clinical outcomes as observed in this table. And also for biceps used as a SCR, isolated SCR for irreparable massive tears, you see the clinical significant improvement for all the outcomes considered. So, starting from this point, for sure, one option, an alternative option to the biceps is the use of another tendon, single strand or double strand, whatever you want, but some others describe it as multiple strands, for example. But the use of a tendon to replace the capsule, so not a patch, but just a single or multiple strands. And this is the technique that we reported 2 years ago. The semitendinosus is harvested in a standard fashion from the anteromedial aspect of the proximal tibia, so it's doubled and pre-tensioned. Then the glenoid is prepared standard fashion like for a standard ACR, so the superior glenoid labrum is preserved, the glenoid neck is a little bit braided to receive the graft. Then the graft is pulled from the lateral to the medial posterior portal, and then is fixed on the posterior superior pole of the glenoid with a suture anchor. I use a knotless suture anchor as a single point fixation. And then the graft is looped. The loop is maintained laterally, and then the other end is pulled anteromedially and fixed on the anteromedial side, anterior superior side of the glenoid, in the same manner, so with another knotless anchor. So finally, I have a loop on the lateral side that is fixed with two more suture anchors in a box-shaped configuration, or with a single point fixation if you want to consider a V-shaped configuration, reverse V-shaped configuration. So I prefer a box-shaped because I really recreated two different strands, so an anterior and posterior cable. And this is finally the result. That does not cover the whole, but has theoretically the same strength and the same mechanical function of the standard SCR with the patch graft. This is a clinical case that I want to show you. This is a lady, left-handed female with a degenerative posterior superior rotator cuff tear. She had a previous rotator cuff repair on the right side, sedentary work, full passive range of motion, deficit, strength in elevation, pain, weakness. But at the MRI, we have no signs of biceps. So it's not available for a reconstruction with the biceps. So in this case, this is an alternative. And look at the left shoulder. The left shoulder was operated 4 months before. And she has a complete range of motion, active, passive, no pain at all. And results are pretty satisfactory in these cases. Of course, the level of activity is limited because she's a sedentary worker, but the results are pretty good. Another option for superior capsule reconstruction is a combination of dynamic and static stabilizers. So combining tendon transfer and the superior capsule reconstruction. This was one of the first studies that proposed this theory and this chance, this possibility of technique. And lower trapezius is for sure one of the most effective transfer technique to achieve a regain of external rotation strength. And when you combine this technique with possibly a superior capsule reconstruction, you can maintain the center of rotation and you can improve, you can make more effective the action of your tendon transfer. So while I was talking about this possibility, all around the world, Maristella was doing that. And once I was in the OR, in her OR, I said, "What are you doing?" "I did it," she said. "I did what?" "I did. I combined the superior capsule reconstruction and the lower trap transfer." This is one of the first cases she did, and that's a really promising technique. So in conclusion, superior capsule reconstruction with the semitendinosus is an alternative to biceps. It's useful in revision cases when the biceps is previously ruptured. The cost is very limited because it's an autograft. You can consider a combination with the lower trapezius transfer because you have a restoration of coronal and horizontal force couples, and you can improve the strength of your transfer and the final result in terms of motion and strength as well. Thank you very much.